Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community. To help prevent the spread of the coronavirus, here are a few tips you should know. Practice proper hand washing by using soap and water and wash for at least 20 seconds. Use alcohol-based hand sanitizer if you cannot wash. Avoid touching your eyes, nose, and mouth. Cough and sneeze into a tissue and throw it away. Clean, high-touch surfaces frequently. Some examples include doorknobs, credit and debit cards, cell phones, keyboard and mouse devices, and toilet handles. Stay home if you're feeling ill. If you have any flu-like symptoms, avoid contact with the public. Avoid sharing personal items in spaces with those close to you. Seek medical care early if you're feeling sick. Symptoms of the coronavirus can include fever, coughing, and shortness of breath. Seek medical care if you develop these symptoms or if you've been traveling or have been in close contact with a person who has traveled from an area with an ongoing spread of COVID-19. We encourage you to visit hcflgov.net/staysafe for up-to-date information and tips.
The Florida Department of Health has teamed up with Hillsborough County government and other public health and safety agencies to address any impacts coronavirus may have on our local community. Not everything is known about the coronavirus yet, but the Center for Disease Control and Prevention, CDC, has narrowed down key symptoms of the virus: fever, cough, and shortness of breath. The CDC says these symptoms may even appear 2 to 14 days after exposure to the virus. If you experience these symptoms, you're urged to stay home and call your doctor. It's important to know the difference between symptoms of the coronavirus and other illnesses. The CDC says people who have the flu will often feel some or all of these symptoms: fever or chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, allergies. The common symptoms of seasonal allergies include sneezing and an itchy, runny, or congested nose, itchy, red, watering eyes, wheezing, chest tightness, shortness of breath, cough, raised, itchy, red rash, swollen lips, tongue, eyes, or face, dry, red, and cracked skin. You should call your doctor if you develop symptoms and have been in close contact with a person known to have COVID-19 or have recently traveled from an area with widespread or ongoing community spread of COVID-19. We encourage you to visit floridahealth.gov for up-to-date information and tips.
The Florida Department of Health is working around the clock to identify those who are most at risk of contracting COVID-19. We are prioritizing testing for any individual who is symptomatic, fever, cough, shortness of breath, and has traveled through an area of community spread. We encourage them to contact their medical provider. Please don't self-diagnose. Describe the symptoms that you are having, work with your provider, and if your provider feels that you meet the criteria for COVID-19 testing, they can coordinate through one of the commercial labs, LabCorp or Quest. There's a two-step process, which includes a specimen collection kit and then a test kit. The specimen collection kit includes the swabs and the sputum culture that are collected from the patient, which are then sent to the lab where the testing kit is housed. The testing kit includes reagents, which are basically chemicals that run the test to prove whether the person is positive or negative for COVID-19. We encourage social distancing because it is very easy to spread through droplet transmission, meaning if someone coughs or sneezes near you and you breathe that aerosolized matter in, you are now possibly infected with the virus. We want to isolate the sick for 14 days because that's typically the duration of this virus. At the end of the 14 days, if they are symptom-free, then they have the potential of testing negative for the virus. But they do have a clearance process for those individuals. For the latest information on the COVID-19 virus, we encourage everyone to visit the Florida Department of Health and the CDC websites.
The Florida Department of Health, along with its partnering health and safety agencies, is reminding residents to stay vigilant and help stop the spread of COVID-19. People with confirmed or suspected COVID-19 who do not need to be hospitalized, or those who were hospitalized and determined to be medically stable to go home, should restrict activities outside their home except for getting medical care. Do not go to work or public areas. Avoid using public transportation, ride-sharing, or taxis. Be sure to separate yourself from other people or animals inside your home. You should stay in a specific room and use a separate bathroom if available. Call ahead before visiting your doctor. If you have an appointment, call the healthcare provider and tell them your symptoms. This will help the office take steps to keep other people from getting infected or exposed. Household members and caregivers who have close contact with someone who has confirmed COVID-19 should stay at home and monitor their own health and call their healthcare provider right away if they start developing symptoms. We encourage residents to visit the Florida Department of Health and CDC websites for more on this topic.
Hillsborough County has teamed up with the Department of Health and other public health and safety agencies to address any impacts the virus may have on our local community. To help prevent the spread of the coronavirus, here are a few tips you should know. Practice proper hand washing by using soap and water and wash for at least 20 seconds. Use alcohol-based hand sanitizer if you cannot wash. Avoid touching your eyes, nose, and mouth. Cough and sneeze into a tissue and throw it away. Clean, high-touch surfaces frequently. Some examples include doorknobs, credit and debit cards, cell phones, keyboard and mouse devices, and toilet handles. Stay home if you're feeling ill. If you have any flu-like symptoms, avoid contact with the public. Avoid sharing personal items in spaces with those close to you. Seek medical care early if you're feeling sick. Symptoms of the coronavirus can include fever, coughing, and shortness of breath. Seek medical care if you develop these symptoms or if you've been traveling or have been in close contact with a person who has traveled from an area with an ongoing spread of COVID-19. We encourage you to visit hcflgov.net/staysafe for up-to-date information and tips.
The Florida Department of Health has teamed up with Hillsborough County government and other public health and safety agencies to address any impacts coronavirus may have on our local community. Not everything is known about the coronavirus yet, but the Center for Disease Control and Prevention, CDC, has narrowed down key symptoms of the virus: fever, cough, and shortness of breath. The CDC says these symptoms may even appear 2 to 14 days after exposure to the virus. If you experience these symptoms, you're urged to stay home and call your doctor. It's important to know the difference between symptoms of the coronavirus and other illnesses. The CDC says people who have the flu will often feel some or all of these symptoms: fever or chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, allergies. The common symptoms of seasonal allergies include sneezing and an itchy, runny, or congested nose, itchy, red, watering eyes, wheezing, chest tightness, shortness of breath, cough, raised, itchy, red rash, swollen lips, tongue, eyes, or face, dry, red, and cracked skin. You should call your doctor if you develop symptoms and have been in close contact with a person known to have COVID-19 or have recently traveled from an area with widespread or ongoing community spread of COVID.
You are live.
Good afternoon, everyone, and welcome to the Emergency Policy Group update on coronavirus. I hope everyone's ready for us today. Before we get started, I want to make an announcement that all of us should have our phones on mute unless you're ready to speak. Also, if you're watching on any other device such as TV, Facebook, or YouTube, please make sure that your volume is turned off. That way we won't get so much feedback into the phone line as we have in this meeting. Will the clerk please call the roll?
Good afternoon. Miller?
Here.
Overman?
Here.
Herman?
Here.
Cronister?
Here.
Castor?
Here.
Ross?
Here.
Lott?
Here.
Lively?
Here.
Thank you. You have a quorum.
Okay. Was anyone missed this time? Mr. Merrill, you on the line?
Yes, I am.
Very good. Thank you all for being on the call today. Before we move any further, I'm going to call on Mr. Tim Dudley, the Director for Emergency Management, to give an update.
Good afternoon. This is Tim Dudley, Hillsborough County Office of Emergency Management Director. As of noon, March 25th, Florida Department of Health reports 1,682 cases of coronavirus in Florida, with 22 resulting in death. In Hillsborough County, there are 106 cases, including 100 residents and 6 non-residents. Their ages range from 3 to 86, with an average age of 44. No cases has resulted in death in Hillsborough County at this time. 2 have recovered. Our current objectives. The collection site opened this morning at the Raymond James Stadium. As of 12:30, we had about 160 specimens collected, and we will continue to collect specimens up until 2 o'clock today. The collection site call center was stood up on Tuesday, and it runs from 8 to 5 p.m. to pre-screen parties interested in COVID-19 testing at the Raymond James site. As of yesterday, there were a total of 1,095 calls, 198 calls for testing, and 113 reservations. And they continue to make reservations through today. We've also stood up a donation management site at 250 West Shore Plaza in Tampa, and we have started receiving medical supplies and PPE donations from the community with operations from 9 a.m. to 3 p.m. Monday through Friday. We will conclude this collection April 3rd. We continue our planning for efforts for wraparound services to provide support to persons in the county and its quarantine and isolated locations. We'll be exploring options to augment space for quarantine and isolation. We continue to coordinate countywide logistics support and manage PPE requests from healthcare communities, collecting resource requests and submitting them to FDEM. Warehouses receiving deliveries. Communication status with requesting parties has been established, and pickups have proceeded. We're distributing orders to our partners, and we continue to preparations for alternate care site operations, exploring options for alternate care sites. And we will continue to provide relevant and timely information to decision makers and stakeholders. This concludes my update.
Thank you, Mr. Dudley. Are there any questions, Mr. Dudley? Any questions? Any questions? Okay, thanks, Mr. Dudley. Thank you very much. We're going to go into a part of the agenda that I'm going to ask Mr. Merrill to start off, and then followed by Mayor Jane Castor. Let me say this before we get started. Ladies and gentlemen, and everyone that's listening and everyone out there, every person on this call and every person that's not on this call that's an elected official or appointed in some type of capacity have been working and have the utmost concern about what's happening in our county. We want to protect every soul in our county from this pandemic, this virus. We may not have been agreeing on how to get there, but you can believe that we all have the same concern and trying to get to some type of conclusion of what we need to do to protect this county. I don't care if we live in the city of Tampa, Plant City, Temple Terrace, or unincorporated county. Each and every one of us are putting everything we can and have put everything we can since this thing started to try to make sure that everyone is safe, and those that have been affected, we pray for them, and we want to make sure that this does not spread in our community. And I think that we have worked very hard on the 3 C's I talked about on Monday. That was the coordination, the collaboration, and the communication. And I believe we're at a point now that we can come together and take off the armor of war and lay the olive branch on the table, and let's work together to get these things done. So I just wanted to say that because there's been some people out there that think we're fighting, and the emails have been flowing in, and some of them have been pretty downright nasty emails. But believe me, I don't care where you represent or what part of this county you represent or what agency you represent or what government you represent, each and every one of us have been working to try to make this county the best it possibly can be and protecting each and every person in this county regardless of where you live. So I just wanted to put that out there. So at this point, I'm going to call on Mr. Merrill and then Mayor Jane Castor. Mr. Merrill.
Thank you, Mr. Chair. Just by way of introduction, I just want to say that the primary reason for the order that I issued yesterday and for scheduling today's EPG meeting was to provide for a timeout, for a space to have a discussion and find a united approach in finding the interests of the community safety. And so this morning, I talked with Commissioner Miller about some proposals to do just that, to find a compromise that would bring the community together, that perhaps would find a way for EPG members to have a unified approach. I also spoke with Mayor Castor, and the result of that is the document that we forwarded to you, that I forwarded to you this morning. I just want to emphasize this is a work in progress this morning. The urgency of this, the importance of this is driving us every day to try and find ways to serve the community. So for the record, I just want to say that if I had been able to do this sooner, I would have gotten it to you sooner. The purpose of putting it on the table today is for transparency. There's no agreement that's been reached by anybody. Only the concept of trying to reach a compromise on these serious life safety and welfare issues. All options are on the table for the EPG to consider and take action. So because this document was just delivered this morning, I'm going to take the time to walk through it and give you a little insight into what the thinking was. So it begins really with the importance of identifying the desired outcomes that we all agree on. And in fact, I would say when you step back and look at it, probably 95% of this is something we have already agreed on. We may not realize it, but we do. And so in the desired outcomes, if you have the document in front of you, first of all, we all agree we need to take effective and reasonable steps to protect the health of residents and the community. Secondly, we agree that we don't want to create long-term irreparable economic harm to our residents, our businesses, and to the local and regional economy. Third, we agree that unified action is paramount to ensure the most effective results and cause the least confusion and panic in the community. We also agree that categories and types of essential businesses and services that must remain open. And that's because we're all working from the same document, which is the Homeland Security guidelines. And finally, we agree on the types of businesses that by definition cannot continue to remain open because they are unable to maintain the required physical distancing to keep customers safe. So with that as kind of a preamble of things that I believe we agree on, the second item are what I am proposing are really guiding principles that we must agree on to achieve the desired outcomes. First, that we must take a measured, reasonable, and unified direction for the entire county through the EPG as elected representatives of residents of this community. That's why this forum exists. It's an important way for elected community leaders who represent constituents to hash these issues out. Secondly, it requires personal responsibility by businesses and residents to observe the mandatory behaviors that have been proven to mitigate the spread of the virus. So with those two principles in mind, the document proposes the following. First, that unified actions by the EPG can be taken immediately to achieve the desired outcomes that I mentioned earlier. First, to institute what some other counties are calling a safer at home approach and a curfew. So it's the combination of the two approaches. So the curfew, and I'll say that this proposal does not negate the need for the curfew order that's before you today. It really combines the curfew order with a directive that is meant to send a message to businesses and residents that they need to take certain actions to be safe and be safer at home. So first of all, the curfew would extend from 10 p.m. to 5 p.m. Monday through Friday. That's what's currently in the proposed curfew order in front of you. The addition to that I'm proposing is a 24-hour curfew starting 10 p.m. Friday through Monday at 5 a.m. Moving to the Safer at Home directive, that would apply 24 hours, 7 days a week to encourage residents to stay at home. 3B describes that both the curfew and the stay-at-home directive are subject to the following. First, it exempts the essential services that we have already agreed on, that I mentioned are embodied in the Homeland Security guidelines. Secondly, both the curfew and the stay-at-home directive permits residents the unlimited ability to get the necessary food, medicine, and essentials that they need. Third, the curfew and stay-at-home directive also permit residents to recreate and enjoy the outdoors as long as physical distancing is observed, along with the other recommended sanitary requirements. Fourth, both the curfew and stay-at-home directive provide that those who cannot work remotely and must work shall maintain a 6-foot distance from customers and fellow employees. And finally, workers who cannot maintain a 6-foot physical distance from customers shall not work. And those businesses that cannot, by definition, maintain the necessary physical distancing from customers must close until further notice. And that, of course, would accept medical and other essential services that are embodied in that Homeland Security guidance. Moving on to 3C, the essential businesses that are permitted to continue to conduct business under the proposal shall comply with the following or be subject to penalties and fines. First, those essential businesses must direct workers to telecommute when that is feasible. Secondly, it provides that those essential businesses should provide employment opportunities to those who lose jobs because of this emergency by working directly with CareerSource and other designated employment and job agencies. And I'll just note that the county government will be doing this by streamlining our normal hiring processes and procedures to quickly onboard necessary workers, prioritizing those who have been displaced. And finally, essential businesses shall put into place all of the recommended public health department mitigation procedures and practices to protect workers and customers. D, this is item 3D. Local businesses that produce and provide essential necessities such as food, medicine, medical equipment, supplies will prioritize those goods for the use of Hillsborough County. 3E, local businesses that have the ability to do so shall alter their production and manufacturing in order to provide products that meet the need of the county for critical testing, collection, protective gear, and treatments. And finally, we would encourage those with the financial means to increase their financial support to local charities and organizations that provide direct social service and employment services to displaced workers. That is the proposal in an attempt to try and find common ground. I know that not everyone's going to agree, but stressing what I said earlier, there has been no agreement. Everything's on the table. The proposal here would be something the EPG would adopt as an executive order. And with that, Mr. Chair, I'll turn it back to you.
Thank you, Mr. Merrill. Thank you very much. Mayor Castor.
Thank you, Chair, and thank you, Mr. Merrill, for that. I think that the compromise here with the curfew and the safer at home order would certainly best serve our community, and I echo Chairman Miller's statements about everyone's concern. We are in an unprecedented time, and we are dealing with a dynamic, ever-changing virus that requires our immediate action in order to reduce the transmission of this and that curve. Hearing people talk about very, very important. And what I would ask is that we try to come to a consensus. I know that there'll be changes, and what was just read, a couple of things that I see and hear, but I would implore everyone else to not make this more difficult than it needs to be. Time is of the essence, and we have got to act very, very quickly. We currently are number 3 in the state with a positive number of cases, and we know that we have only been able to do minimal testing. Just this morning, we had to put 30 police officers into quarantine, 3 last night from CPR on an individual that expired and from an unknown cause. So we have got to act quickly, and we've got to take every step we can that will protect our citizens and hopefully flatten this curve. Other cities I shared with Mr. Merrill, Orange County and Orlando had done a similar stay-at-home and curfew order, so we can use these all as guidelines. But I just want to underscore the significance and the importance of acting very, very quickly and not making this more difficult than it has to be. Thank you.
Thank you, Mayor. Thank you, Mr. Merrill. Thank both of you for working on this and getting it together as fast as we possibly can. I now open up for any questions. Any questions? Questions?
Commissioner Merman, I do have a couple of questions. Thank you, Mr. Chair. And I do appreciate your efforts and our county administrator to work with the mayor to help us come to an agreement on this. It's very important that our citizens see us having one voice. And of course, the mayor, I always appreciate your zeal and efforts to get things done. You've always been a great partner in the community. The one thing that is in here, and you know, I've been a strong advocate for small business. We have 20% of all of our businesses in Hillsborough County. 83% have 20 or fewer employees. So it's a major part of our community. And I know we were going to do the curfew, but I didn't believe that we were going to undertake a list of essential businesses at this time, that everybody would be able to stay open as long as they went by the CDC guidelines and had the 6-foot rule. So I guess I'm just asking for clarification on that, and if that can be changed from this document for now. Obviously, as things go along, this group can, make it more stringent as we move down the road, as I know this is an important first step for us. So I guess that's my question. I don't know if it's you, Mr. Merrill, who it's to, but I have a pretty big concern about starting off with essential businesses, because as you know, this is like doing the budget in Tallahassee. All the lobbyists in the world will start to say, well, I want my business in there. I want my business in there. And, I think, why don't we just let everybody stay open as long as they adhere to the guidelines? If they don't adhere to it, then, they can't stay open.
Mr. Merrill, I hear what you're saying, but I think under 3B, number 4, besides essential businesses, it says those who cannot work remotely and must work shall maintain a 6-foot distance from customers and fellow employees. Does that not meet the needs of what you're saying?
It just seemed like 1D and 3, the one you just referred to, kind of conflicts with each other. So that's why I wanted some clarification.
Mr. Merrill,
Mr. Chair, this is Mike Merrill. Let me answer that. So, Commissioner Merman and EPG members, the concept of essential services has sort of always been there, and it really is incorporated into the curfew order that's before you today. It's not necessarily identified as such, but it's all based off of that Homeland Security guideline that everyone is using. And so what the proposal is doing is really identifying those essential businesses which have to stay open, which is a very, very, very long list. And I've been getting probably the same emails that you have, and I would venture that most, if not all, of those who've asked to be considered as essential are already part of that Homeland Security list. What we are doing in the proposal, or what I'm proposing in the proposal, is that we then further focus on companies that just by definition of what they do, there's no way humanly possible to maintain 6-foot distance. And those on their face cannot continue to operate. But for everyone else, during the week, if they can maintain a 6-foot distance, we prefer they stay home or telecommute, but if they have to work, they can. And so that's really sort of the compromise here. I don't know if that helps at all.
So, so does that mean only people that are listed on there, which would probably exclude most of our small businesses, they would not be able to operate, or would they?
They would be able to operate. So under 3B, subparagraph 4, those who cannot work remotely but must work shall maintain a 6-foot distance. But 3B5 says that workers who cannot maintain a 6-foot distance cannot work.
Okay.
So it's trying to find a compromise while recognizing that there are essential services. So here's the bottom line. We would prefer, for all the reasons that we know, that those who are not in essential services should stay home. That's the directive element of the safer at home. Everyone should make every possible attempt to stay home, unless you're in essential business. But if you just can't, you still have to maintain a 6-foot distance. And if you can't, you have no business being in that place, because you're putting yourself at risk and you're putting the customer at risk. That's the essence of it. That's the reality of it.
Okay, so, and I hate to keep bringing up these examples, but the guy, the single business owner that has a storefront somewhere, is he going to be able to walk in and conduct his business? He doesn't interact with customers. He does everything over the phone or, whatever. Is he still going to be able to operate?
That would be contemplated here.
Yes.
That would?
Yes.
I'm sorry, I couldn't hear you. You broke up.
If that
Yes,
person
that would be
is a single business owner and he's not communicating with people and he doesn't have to worry about the 6-foot distance, he's doing it on the phone, and he must work, that will be covered under 3B4.
Okay. I just want to make sure we offer clarity, which I really think this, what you've written up, this outline, really does help us get a long way to bring clarity for our businesses and the residents on exactly what they can do and can't do. So I'm just glad that you clarified that. Thank you.
Are there any other questions?
Mr. Chairman, Slot.
Yes. Merrill, you recognize.
First of all, Mr. Chairman, I want to thank you for your opening statements and your opening comments. I definitely appreciate your strong leadership and doing your best to hold the EPG together as one voice, and I just want to commend you on your effort. Also, I want to thank our county administrator for constantly working towards doing what democracy is all about, listening to the 8 of us, working with the 8 of us, and trying to find a balance, because all of us here have the same goal in place. Our goal is to be able to, keep ourselves healthy, rid this virus from our community, as well as keep us working to where we have the ability to resemble and keep our quality of life at the best possible that we can as we're conquering this epidemic that we're facing. I came here today because I felt like the document that you drafted on the curfew, even though I don't like the term curfew, okay, but I thought that was a document that could bring us all together, because it allowed us to keep our county working, allowed our services, allowed us to be able to take care of our elderly and those that are sick, it allowed us to be able to still function as a society in Hillsborough County, but it also gave the leverage to our law enforcement to be able to take care of those that no matter what we put in place, they're going to probably push back on a resolution or order or a mandate. So I thought it gave our police department that additional hammer, so to speak, to be able to keep our community safe. With what you're presenting here today, I think I can, support it. I'd like to talk about it a little bit more because I think it accomplishes the exact same thing except for one area of concern, okay? The Monday through Friday, 10 p.m. to 5 a.m., I think it accomplishes the same goal that we had in the curfew that we were going to discuss today. But I have a question here. Could you explain, or have our Mike Merrill explain the reasoning for the 24-hour curfew during the weekend?
Merrill?
Yes. So the thinking behind that is that in the rest of the proposal, we have really, I think we can really do a good job of managing this in a way that gets us to the goal we want to get to but still allowing everyone to work. And so I felt that if we took that approach, the greater risk still potentially existed on the weekend, where there was greater opportunity for then more contact, less physical distancing to happen. And so by including a curfew through the weekend, but yet allowing people to still get their necessities, to recreate as long as they maintain the proper distance, just added an additional bit of force and intent and seriousness to this without really hampering people's ability to get essential stuff done. And so that was the thought behind it.
So if I can add to that, so the Monday through Friday makes total sense as we described earlier and you outlined earlier. But on the weekend, I just want to make sure we're clear here so that none of us in our community is, I don't want to, we were already kind of policing each other, citizens saying you can't do this, you can't that, and I understand that probably should be happening, but I want to make sure our citizens understand. Does that mean if someone is out on their bike on the weekend or taking a walk, or if they take their boat out to a boat ramp and go fishing and whatever, that they're not allowed to do that, or can they still recreate?
No, I think that is an exactly good example of what we want people to do. We want them to be out getting exercise and doing all those things that are important to keep us healthy. So that would be something that would be permitted.
So in essence, then, what this is really just promoting is safe social distancing, so that we're trying to make sure that our actions don't harm others. Is that correct?
Exactly. So it adds additional force to the requirement of personal responsibility. And, in talking with the sheriff, and he could speak for himself, but, the goal of law enforcement is not to put people in jail or take a hard approach. It's really to make sure people are aware, to educate them, to give them a little extra push if they need it. And that's really what this does. It takes that sort of extra step beyond personal responsibility.
So, Mr. Merrill, one other question. I think you and your staff and those that have been contributing to it, I know since our last meeting, we've all been contributing to the essentials list, because obviously every community is unique and we have unique differences from Orange County to some other county around the country. So I know I appreciate the efforts in our community and other communities trying to create a list that validates our community. But there are going to be situations where we're just going to leave someone out. Like, for instance, we have one of the largest wholesalers of parts and supplies for RVs, and a lot of people live in their homes or live in their RPs, and I don't see that in our list here. So if we had a situation like this, and if we approved this particular order, I'm taking the assumption that we could still call you and have an essential list, and you have the authority to add something to the list if we left something out, which was an unintended consequence. Is that true?
Yes, that would be true.
Okay. I'll that's all the questions I have at this time. Thank you.
Okay, well, thank you. Any other questions?
This is Commissioner Overman. I have a question, please.
Mr. Overman, you recognize.
Thank you, Chair. Great work. I really enjoyed seeing that we're going to put something in place to give our citizens some guidelines on what they can and can't do. But most importantly, the goal here is to give our medical industry enough time to get ready to provide care for those that are exposed and at risk of the virus. So the items in item 2B that describes personal responsibility by businesses and residents to observe the mandatory behaviors that have been proven to mitigate the spread. And then item 3, 5 that talks about workers who cannot maintain 6-foot physical distance shall not work. I think we need to make sure that our communications are very clear, that it doesn't mean you have to close down your business if you can figure out a way to telecommute. And what we've heard, I think, in our emails and stories that people tell us is that I'm having to still go to work because my employer says I have to be in the office. But my office may not have been sanitized. There's, 20 people in a lot of space. I can stay 6 foot away from them, but I still don't want to be there because I'm afraid I'm going to bring this home to my family. So the telecommuting, in whatever language we end up in, I think needs to be emphasized. If your business can still function and telecommuting is an option, it is, in order to stay open, it needs to be mandatory or something along those lines.
Yeah,
is
and
that
that's actually
in this review?
Pardon?
Yes, actually, Commissioner Overman, in 3C, that was really the attempt to put the onus on those businesses who are staying open to have their workers telecommute when it's feasible, but also to take responsibility and make sure that back on 3C subparagraph 3, that those workers who are still in the workplace need to be protected by the employer who has to put into place all the recommended public health mitigation procedures.
Excellent. I'm really glad to see that, because that's, I think, what's critically important for us to reduce the spread that's in our community that we may or may not have the resources yet to identify and mitigate, other than separating out. As Mayor Lott referenced, the essential services list and the description of this does have some areas of negotiation I think that all of us would probably want to address. I'd like for the drafters of the document to consider one item that's in our essential services list where it addresses hotel, motels, and commercial lodging establishments. There was language in the Broward order that prioritizes essential lodgers like healthcare professionals and first responders, and prohibits some level of renewal. I'd like for the Dr. Holt or others to opine to the benefit of actually limiting hotel establishments, that except for making sure that we have room for people that have to be isolated because they are under observation. Because in the plan we saw earlier, or we were sent earlier, shared with us earlier, then when someone is medically stable but at risk and need to be isolated, we send them home. And that may not be practical for someone who lives with other people. So addressing prioritization for rooms or hotels or motels to address this, until a later date when we have bed capacity, hospital bed capacity, to address the increase in the virus spread. I think that somewhere in that language we might want to consider using what Broward put into place. And there is no language within this document that addresses people that are at risk that I can see. It might be here. But in the Illinois language, there was exceptions for people that were at risk of domestic violence, as well as in unsafe living environments, from a curfew kind of arrangement. They need to be able to know that they can reach out for help when they have it. So if that can be adopted, or at least crafted within here, to allow our citizens to know that if they're in danger, that they can leave their home with a curfew language. my challenge is the difference between a stay-at-home directive or order and a curfew, and what we're accomplishing with curfew hours. If the safer at home directive is clear, concise, and easy to understand by our public.
Merrill, you want to address that? If you can.
You're asking?
You're asking Mayor Castor?
Oh, I'm sorry.
No, I asked Mr. Merrill.
Oh, okay. Yeah, so the main difference, I think, and Mayor Castor can certainly weigh in too, is that the curfew is a harder requirement or a more stringent requirement, whereas the safer at home is a directive. It's softer, still has force, but it allows some flex and greater ability to, to be able to move and to work and get things done, but still recognize the importance of mitigating the virus. So I think that's the difference.
Castor, did you want to say anything on that?
Yes. We're not going to be able to cover every single item here or every single business as essential. I think that is pretty wide open. But the way that I've been explaining it to everyone is that 6-foot distance. That is our test, and it is the best way of explaining it. If you can't work from home and you have an essential service, if it cannot be performed with the ability to stay 6 feet away from other individuals, then you cannot perform that. And if you have a business, then that business would have to be closed. A lot of these businesses are going to self-regulate. If they don't have customers, then they're not going to be able to keep the doors open. And one of the things too that I would like to cover is that what we need to communicate very clearly is going to be the enforcement of this. Enforcement is going to be through education and encouragement, especially in the beginning, because what we want is everyone to cooperate in their best interest and in the best interest of our community. So that needs to be communicated far and wide as well with this order directive.
Thank you, Mr. Merrill. Thank you, Mayor Jack Castor. Are there any other questions?
Mr. Chairman.
Yes. Who is this?
Andy Ross.
Yes, Mayor Ross.
Well, first of all, I'd like to thank you and Mayor Castor and Mr. Merrill for working so hard on this. It is, I think, in the best interest of everybody. Like all compromises, there are 8 of us on this board, and there are probably individual things that we would like to write a little differently. I see a couple of things that I would like changed a little bit, but that's the nature of a compromise, and I think everything in here is language that we can all live with. I recognize that language is never perfect, and as we move forward, there will undoubtedly be circumstances that we didn't foresee, target audiences that we didn't address, or things that come up that we're going to have to tweak and amend this order as we move forward. I think that everybody would probably understand that. So, I applaud you, all 3 of you, for coming up with this document. I think this is a very good starting point, and I'm prepared to make a motion when you're ready for one, sir.
Yes, sir. Well, hold off on that motion. You are the mayor now, right?
Well, I'm not sure. I think I'm still the vice mayor.
Okay. All right. Let's hold off on
Mr.
the
Chairman.
motion. Get all the questions. Yes. Who's speaking?
Rick Lott.
Yeah, Mayor Lott. You recognize.
Okay, so let's say if we did come together on this, obviously the communication and making sure we get this out to the public, the accurate information, what this really is, not the perceptions of what it is, what the, how it actually would affect our community. How would you propose that? Because I think one of my fears would be is that if we try to push this off, let's say if we started at 5 o'clock today, for instance, there's no time to educate the public, our business community, all these organizations that would be involved in it. And there would probably think a lot of bad decisions that we make that had inadverse effects on our community. Have we had any discussion on like an effective date, how we'd get the word out, how we'd educate the community on this particular issue?
Let me address this, and then maybe Mr. Merrill can, or one of the attorneys can. Today, if we decide to do this, we would have to make a motion to have Mr. Merrill and the county attorneys and all other attorneys involved, and the sheriff involved with his attorneys, to come back to work on this today and tomorrow morning. This body, the EPG, would have to come back tomorrow at 1:30 after receiving a draft of the order, and then at that point, vote to put it in place. And I will probably say midnight tomorrow night or something along those lines, whatever they bring back. Not today, because we have to have it drawn up with all the legal aspects put into place. That we don't want to violate anything that the state has put in place. We don't want to do that. But we will make a motion today to have Mr. Merrill with the county attorneys, city attorneys, your city attorneys, whoever attorneys we have, the sheriff attorneys, whoever, to work on this between now and sometime tomorrow. We will get copies of it prior to the EPG meeting at 1:30 tomorrow. We'll come back at that point. If everything's satisfied and the dates and times put into place to make it effective, we then vote on it, and it becomes, I don't want to say order, it becomes the order at that particular point in time. Mr. Merrill, am I wrong or am I right?
No, I think that's the best way to approach it. It's still very expedient. We can be ready to go. I think the other answer to your question, Mayor Lott, is that we will have to again collaborate among all of ourselves and have a common message going out of all of our social media portals. We will need to rely heavily on the cooperation of our local media to send out the same unified message, and I think that can be done very quickly. We have a joint information center that everybody's represented in, and I think that can be done pretty quickly. And as Mayor Castor said, this begins as an education, encouragement effort right at the beginning, and then so I think there's a way to get there.
Mayor Lott, did that answer your question?
It answers my questions from an approval standpoint, and I appreciate that. But the effective date, what effective date would this have if we approve this tomorrow at 1:30? Because it's going to take some time letting the public know exactly what this means and how it affects them, so people can make rational decisions and good business decisions from their jobs as well as their health.
Mr. Merrill or Ms. Beck, or would one of you want to answer that question concerning an effective date?
This is Mayor Castor. I'd like to comment.
Okay, Mayor.
All right. Again, time is of the essence, and there are a number of other jurisdictions, counties, municipalities that have gone to these types of orders, and the public, I think, is aware and expecting it. And if we can agree tomorrow on an order and then move forward, as Chairman Miller said, for a midnight enactment, with the community understanding that this is going to be through education, the enforcement is going to be through education and trying to get individuals to cooperate. I think that is fine. I don't think that that's going to cause any panic in our community. The majority of the citizens are expecting this, and we need to do it quicker, sooner rather than later.
Thank you, Mayor. Mr. Merrill or Ms. Beck, any comments concerning what was brought up by Mayor Lott?
This is Christine Beck. No additional comments.
Okay, thank you, Ms. Beck. Mr. Merrill?
No, none for me. I would agree. We have a midnight tomorrow effective date. So.
Did I hear someone want to speak?
This is Commissioner Overman.
I thought I heard a man's voice. Hold on, Commissioner Overman. Was someone else?
Mr. Chair, Chad Cronister.
Yes, sir, Sheriff.
I don't know if this has to be done in motion form, but I believe the term curfew comes with a negative connotation. These orders are drafted so they mirror each other. If you have a legitimate purpose to be out of your home, whether it's from 10 to 5 in the evening or during the day, we crafted the language to make sure they mirror each other. Would this group be acceptable to drop in the term curfew and just have a stay-at-home order from 10 to 5 during the week, and then the 24-hour stay-at-home order during the weekend days?
Any comments on what the sheriff is suggesting?
I personally, I like the idea.
Hold on. I think I hear Commissioner Merrill. What were you saying, Commissioner Merrill?
I think what he's suggesting is really good. I think we're just hanging on one word to kind of define the actions we're trying to take. And he really, by doing what he says, I think it really, again, is bringing more clarity to our citizens who are going to read all this.
I heard someone else's voice. Who was that?
Mr. Chairman, Mayor Lott.
Mayor Lott, you recognize?
I agree with the sheriff completely. As I read this document, I keep on getting hung up on that one terminology right there. So I'm glad he brought that up, and I support changing that completely.
Okay.
I do
Anyone
too.
else on the comments of Sheriff Cronister?
Chair Miller, this is Melissa Snively from the school board.
Yes, ma'am.
I thank you very much, and thank you, Chair Miller and Mr. Merrill, for coming to this compromise and collaboration today and working together. It's very much appreciated by, I believe, everyone in our policy group. So thank you for your diligent effort to come to a place where we all could meet. I do agree with Sheriff Cronister's suggestion. Originally, I was hoping that the word curfew might curtail some of the youthful activity that is occurring out there that does not include social distancing, unfortunately. However, I do believe that in agreement with him, it does, and Commissioner Merman, that it does create some clarity as to what these definitions mean for individuals. I do also concur with Mayor Lott. I'm concerned about the timing of this. I understand there is urgency. However, I do think that people are going to need some time to make plans. Speaking even though I'm on the school board, I am a small business owner, and I understand that small business owners are going to have to make some decisions about their employees and how to work virtually or remotely. And I would suggest making this perhaps in effect beginning at 10 p.m. at least on Friday night, as opposed to midnight on tomorrow after we vote, tomorrow afternoon. So please give some of our local business owners the opportunity to plan so that they can make these objective decisions and responsible decisions for their employees. Thank you.
This is Mayor Castor. Can I speak?
Yes, Mayor Castor, go ahead.
For Ms. Snively, I would ask you why you shut down the schools. This is going to bring us right back to where we were at. No difference. Everyone going about their business Monday through Friday, and they just have to stay at home at night while they're already at home. So we have got to take action. If you haven't planned for your employees by now to work from home, it's a little late. We have got to take action. Our law enforcement officers are being affected. Our first responders are being taken off the street. Individuals are already on ventilators, and we have got to take action. I don't know what universe some individuals are in, but this is a serious issue. We have got to take action. I believe that we should stay with the directive of safer at home and have a curfew at the nighttime hours from 10 to 5 that law enforcement can effectively enforce.
May I respond, Commissioner Miller, to
Yes,
Commissioner
ma'am.
Overman? Thank you very much. Was that Mayor Castor that spoke? I apologize if that was,
Yes, it was
Mayor
Castor.
Castor. With all due respect, Mayor, I just want to say that was a directive that came straight from the governor to our school district. So that was a decision that was not made here at the local level. I just wanted to clarify that that decision came from a higher authority. Thank you.
Okay, bring us to the open. I know you wanted to speak. You recognize.
Thank you. This actually relates to why the curfew is confusing. For people who actually work all week and may have some confusion about whether or not they can go out on the weekend to recreate because they can't do outdoor activity except for on their own property. I think the curfew language is what's causing a bit of a confusion. Not all of us work 9 to 5 on Monday through Friday. A lot of people work alternative weeks, especially our healthcare professionals and others that are on call for repairs. So the curfew language, it doesn't seem to accomplish what we're trying to accomplish. I think a strong, clear directive or order that suggests or mandates staying at home when possible, except for you can go get food, and otherwise you need to be home. You can recreate, but do it responsibly in accordance with the guidelines. I think we can get there. So I'm going to move that we actually presented the document.
Hold on, Commissioner Overland, hold on. I told Vice Mayor Ross I was going to come back to him for the motion. So I'm going to go back to Vice Mayor Ross. We'll see. He wanted to make a motion. I cut him off and wanted to hear more discussion. So I'm going to go back to him. But let me say this. Let's do not let the word curfew, being in or being out, negate the overall matter of what we're trying to do. I mean, the sheriff made a statement. He's in law enforcement. He understands it better than most of us, except for Mayor Castor. And I know Mayor Castor wants it there. But I think if we put it as a directive, we're still meeting the subject area of putting together what we need to put together to make sure we're protecting the citizens. So I'm asking you, please do not let one word being curfew have us in a position where we're not able to communicate and come to one conclusion in a cooperative manner to get this done. Let's not do that. Let's if we're going to make the motion and not have the curfew in there, have it as a directive, I think that we need to get to there so we can all be on one accord, and let's not have that be a hanging point on this whole thing. Vice Mayor Ross, you recognize.
Yes, thank you, sir. I will make a motion. I just have a comment regarding the semantics. I would respectfully have a slightly different opinion. I kind of like the language that we have, and this is why. I know the curfew word has some negative connotation, but I'm not sure that's really all bad. I like the fact that we have a stay-at-home directive in effect 24/7. My concern is if we change the language to say that the stay-at-home directive is only applying during the hours of what we formerly called the curfew, it's going to imply to citizens that except for those hours, they can move around the community at will. And I think that's converse to what we're trying to accomplish. So I personally like the language, and I know the curfew language is not, but I'm not sure that having that language go out there with that effect is all bad. But I like the way this is worded, where we have a safe stay-at-home directive or a safer-at-home directive in place 24 hours a day, 7 days a week. And in addition to that, we have a curfew at those other times. So I don't know if you want me to make a motion at this point or if you want to allow further discussion.
That's why I called back on you, because you wanted to make a motion earlier, and I told you not to because I want to hear some more discussion. So we're back on you to make the motion.
Okay. Well, I will move that we direct Mr. Merrill to work with the attorneys involved in the craft language for our consideration tomorrow along the framework of the document that we received earlier today.
Is there a second?
I second, Mayor Castor.
We have a motion by Vice Mayor Ross, second by Mayor Castor. Is there any discussion on the motion?
Chair Miller, Melissa
Yes.
Snively, I have a
Pardon me?
Thank you, sir. If there are other operations or there's wording that is not included in the essential critical infrastructure workforce documentation that that Mayor Lott alluded to, for example, how are we going to communicate that to Mr. Merrill? What is the best way to make suggestions? For example, some of the wording with regard to supports for education, I believe need to be changed for the document to be more inclusive, and also custodial and janitorial, as well as religious personnel. So who do we make those suggestions to include in that documentation?
Mr. Merrill, you want to address that?
Well, the ones you just mentioned, we can just incorporate in the document we bring tomorrow, and then going forward, probably the best way is to just either send me something like an email, or a text message or something, and then I can handle it that way in the future.
Thank you, sir.
Okay, pardon me?
I have a question. I just have one question, Commissioner Miller.
You recognize.
So, Mr. Merrill, as we get this document tomorrow, and I'm sure you're going to be filling in a lot of these areas with more information. I mean, there is a couple things I need to just clarify that were in the mayor's order, but I don't see them in here. And I just want to make sure that, because there were some companies that were concerned about this language. So do I give that to you?
Yes, you can do that.
Okay.
And as I said before, I think I'm probably getting all the same emails that you are, and
Right.
I haven't really found one of them yet that would not be already included in the Homeland Security list. But yeah, just give them to me and we'll sort it out.
Oh, this one was about having medical personnel on site at construction sites to screen the workers, like an RN.
Medical
medical
personnel are all medical personnel are exempt from the order.
There was a mandate to have them at the construction sites to screen the construction workers or something like that.
Yeah, as long as they're medical workers, they would be an essential service and would be able to do their work.
Okay.
Okay, we have a motion by Vice Mayor Ross, second by Mayor Castor. Is any further discussion on the motion? Any further discussion?
Mr. Chair, Chad Cronister.
Yes, Chair.
Hey, real quick, just before we move to vote, I wanted to clarify a comment that was made. The stay-at-home order from 10 p.m. to 5 a.m. have the exact same exemptions as the 24-hour stay-at-home order. It wouldn't prohibit anyone from seeking gainful employment or be out and about. I just wanted to clarify that it has the same exemptions in it. We wrote the order to mirror each other. The only difference would be it doesn't address businesses operating.
This is Commissioner Overman.
Yes, Commissioner Overman, you recognize.
So we have it's not necessarily an essential business, but they're able to comply with all the other things. And their business model is designed to work 24 hours. But they're able to deal with the social distancing, and they're able to operate. So based on these hours of a curfew, are they unable to run their business between 10 and 5 a.m. if they meet all the other criteria as an essential service?
No, they can operate. So the curfew order that you have in front of you mirrors from an essentiality list what we're talking about on the stay-at-home order, because it all comes from the same source, which is that Homeland Security. And so if the company you just described meets the essential category, they can stay open as long as they need to because they're essential. But they have to maintain all of the social distance, physical distancing, and all the other mitigations.
Okay, and so when we adopt this document tomorrow, if that's the plan, then at 5 p.m. tomorrow afternoon is the plan for an adoption time? Or is it going to be Friday to give folks 24 hours to get ready for something like this?
The effective date? Go ahead.
I think she's talking about effective date.
Right. I mean, we may
Oh,
adopt it
yeah.
tomorrow, but are we giving folks 24 hours to get ready for this and to make appropriate changes in their lives, like what needs to be done?
Mr. Chairman, I have to speak.
Okay,
If you don't mind, I'm going to support Commissioner Oberman here. We have people right now, I'm getting texts from businesses in our community going, how do they get their paychecks tomorrow if it goes into effect at Friday night? Because they're watching it online and so forth. I know we're saying there shouldn't be panic, but there already is panic, you know. And I want this to go into effect as soon as possible, but we also have to make sure we allow enough time for people to understand what we're really doing here. And I don't know how 6 or 7 hours after we adopt something tomorrow at 1:30 to 2:30, somewhere in that range, allows people enough time to be able to make good, sound decisions. So I just hope that we can all have an 8-0 vote tomorrow. And if we have to, you know, sway a little bit to let our citizens get their arms around this so there's less panic and less angst than we already have, I would be able to support this a lot easier. Thank you.
Okay, before we do that, I think the best approach right now is to make an effective date and time today so they can bring that back, and we won't have to have a major discussion about what time it's going to take effect or what day it's going to take effect. We need to give some clarity to Mr. Merrill and all of the legal people that's going to be putting this together. So we have a motion by Vice Mayor Ross and second by Mayor Castor. If someone wants to make an amendment to put an effective time and date, and I think now is the time we need to do that.
Chair Miller, I would be happy to make a friendly amendment to that motion to start at 10 p.m. on Friday. This is Melissa Snively. I'm sorry. Melissa Snively.
What did you say?
I said, thank you, Chair. I would be happy to make a friendly amendment to begin to execute this particular order on Friday at 10 p.m. in order to give our small business owners and workers in the community time to make the necessary plans to adjust to this.
I agree. I'll second.
We have an amendment by Ms. Snively, second by Commissioner Merrill. Is there any discussion on the amendment that says this will go into effect on this coming Friday at, you said 10 p.m.?
Yes, sir. I said 10 p.m. Thank you.
Is there any discussion on the amendment?
Yes, Mr. Chair. This is
Yes.
Andy Ross.
Okay.
I was hoping that we could bifurcate this discussion and agree on the principles of the order at this discussion, and then perhaps defer the discussion of the effective date to tomorrow when we're actually going to officially pass it.
Well, I understand that, Mr. Ross, and Vice Mayor Ross, but I think if we wait until tomorrow, Thursday, all right. If
I'm not going to oppose it over that point. It just seems like it's a cleaner discussion if we keep the two things a little separate. But I mean, I'm not going to hold this up just over that point.
Okay. Any other discussion on the amendment? Any other discussion on the amendment? Seeing none, we're going to vote on the amendment to the motion being that it goes into effect Friday evening at 10 p.m. Roll call vote, please.
Miller?
Yes.
Overman?
Yes.
Herman?
Yes.
Conistor?
Yes.
Castor?
Yes.
Ross?
Yes.
Lott?
Yes.
Snively?
Yes.
The amendment carries 8-0.
Okay. That passed 8-0. Now we're back on the amended motion. Is there any further discussion on the motion by Vice Mayor Ross, second by Mayor Castor? Any other discussion on the motion? Hearing none. Roll call vote.
Miller?
Yes.
Overman,
Yes.
Herman,
Yes.
Munster,
Yes.
Castor,
Yes.
Ross,
Yes.
Lot,
Yes.
Lesley.
Yes.
Motion carries 8-0.
Okay. Thank you. I think we made a major accomplishment. I really do believe we made a major accomplishment for the people of this county. I want to thank you all for that. Ms. Beck, is there anything that you need to discuss at this big point in time?
No, sir, Mr. Chair.
Mr. Merrill, is there anything you need to bring forward?
We do need to extend the emergency order, which you can do today or tomorrow. And I guess Christine will bring back the curfew order part of this separately. I mean, bring it back tomorrow as well. Is that what you're thinking?
Yes, since you said that, I wasn't aware we would be meeting tomorrow, but that will be sufficient time to approve that, and that action should be taken before the safe at home curfew order. But as long as there's a meeting tomorrow, we'll be fine.
Yeah, we're meeting tomorrow, everyone, at 1:30 virtually again. Tomorrow at 1:30, the information or the call-in will be sent out by staff, and at that time we can work on the extension of the state of local emergency. Thank you all. Is there any other business we need to discuss today?
Dr. Holt is on the line.
Hold up, Mr. Merrill.
Dr. Holt is on the line in case anybody wants to hear from him, but if not, that's fine. I just wanted to make you aware he's on the line.
Anyone want to hear from Dr. Holt? Anyone?
This is Commissioner Overman.
I'm asking if anyone wants to hear. Excuse me, Commissioner Overman. I'm asking right now, does anyone want to hear from Dr. Holt? Anyone? Okay. Commissioner Overman, you recognize.
Thank you, Chair. This question actually relates to both the emergency teams that are working so hard, as well as how Dr. Holt is handling things. Have we made a decision, or how does someone who does not have a vehicle acquire testing in the current scenario? Because majority of what the services we have at either Raymond James or others require driving up in a car. What methods do the individuals that don't have a vehicle, since we have a lot of people that don't have vehicles in Hillsborough County, how do they acquire a test if they've done the telehealth process or contacted their physician?
Mr. Chair, Tim Dudley or Jean Early can respond to that if either one of them are still on the line.
Either one on the line?
Jean.
Mr. Early?
Yes, Tim.
Mr. Early?
I'll let Tim if he's here.
I'm sorry, I can't understand.
Tim, are you going to respond there, or you want me to?
Who's speaking? Who's speaking?
This is Tim Dudley.
Well, you answer, Dudley?
Yes, Mr. Chairman. We're taking that for action. I did receive correspondence on that. I'll be working with Jean along with the healthcare teams that have established the site. We have a meeting today at a conference call at 1600 today, 4 o'clock, to discuss what actions we're taking out at the collection site, and we're going to bring that to the table to see what we can come up with a good action for that.
Okay. Thank you very much.
Excellent. Thank you very much. I appreciate that.
Any other questions, any other concerns we need to address today? Remember, tomorrow, 1:30, we'll be meeting again virtually to bring forth the directive we asked Mr. Merrill and the legal staff to work on. At 1:30 tomorrow, you'll be getting the call-in number from staff. If there's no other events to come before today, let me say thank you to each and every one of you We utilized the 3 C's. We did what we had to do to protect the people of Hillsborough County, and that's the first and foremost thing that we should always keep on our minds. And I ask you to continue to pray for those in our county and those that have been affected by this virus. You pray for those that they can recover and get back to some type of normal life. That's the important part of this whole thing. And again, to each and every one of you, thank you very much for your service. Thank you very much for this call. Thank you very much for your discussion. And just be safe. We adjourn.
The organizer has disconnected. The call will now end. Goodbye.